from DHS and HHS to discuss a test and evaluation effort. It would be a three-phase process that includes familiarization with the system. Phase 2 would look at basic information sharing with development of proof of concept exercises. And the reason usage is mentioned here is that when you look at the middleware necessary to, existing middleware necessary to help this project out and also in use, DHS's usage immediately comes to mind. Hippocrates is already working with usage in some other areas, and it's a natural marriage. And then we would look at a proof of concept exercise once all were comfortable that phase 1 and phase 2 are complete. Again, this would be a no cost to participants, and we envision this initiative to also consider those landmark projects that are out there. Many have heard and should have heard of Virtual Alabama and Viper. These are great software products developed, Virtual Alabama, obviously in Alabama, Viper by Virginia. New Orleans has a BIOC project that they're working on, very strong Business Emergency Operations Center. And Aid Matrix is an NGO that looks at donation management and is a very strong player in the emergency management and recovery arena. So as we look at ways to link our national homeland security efforts together, we would like to consider this project. We'd like to consider Hippocrates as a potential high-level architecture, not necessarily saying that Hippocrates would be the final architecture, but using it in proof of concept to try to move something forward. Laura, if we go for the questions and answers now, or comments?
I do have a question that came through on chat, Dave. How do you separate private sector info from government info?
Without going into a lot of detail about the software itself, every user and every organization, when they come onto the system, has an individual profile created. By doing that, the originator of the information can say or can choose who to give information to. So it's not necessarily a separation of private sector and public sector. It's more a separation of the originator of the information, so that if a private sector provided the information, it would be noted that it came from the private sector. If the private sector did not want public sector to see it, they could so choose.
Okay. And is there a plan to expand the system into the private sector somehow?
Right now, the system is capable of accepting any private sector who would want to be in the system. So the two answers to that are, for the purposes of the software can already accept the private sector. From a policy perspective, yes, it would be very advantageous to bring private sector into the system.
Okay. I just unmuted the phone for Craig Wiener. Craig, can you hear me okay?
Yeah, I can. Hi, this is Craig Wiener from Best Value Technology. I saw your information related to critical infrastructure. I was at the Chemical Summit Conference in Baltimore this last week. Office of Infrastructure Protection through the CFATS program, especially, which is relevant for New Jersey, collects a lot of critical vulnerability information from various Tier 1 and Tier 2 chemical producers in the state. What kind of information sharing arrangements? Most of that information is classified, yet it's relevant to New Jersey's overall security picture. How are you planning on to incorporate classified databases or information that's relevant to incident response or heads-ups related to BioWatch, the INVIS system through the Office of Health Affairs, and then the CFATS program and other terror alerts that come through CFATS?
Very good question. First of all, I should mention that we are working with our critical infrastructure people in Homeland Security on the project. And again, emphasizing that any classified information, that Hippocrates is not built as a classified system, nor would any system built for Homeland Security. It is not built right now as a classified system, nor would we want it to be at this point. As far as that information sharing, there's two parts to it. If it were critical, I don't want to indicate that Hippocrates would be necessarily a replacement for existing emergency management systems by organizations. and I would hope that through either fusion centers or other means that if it was indicative of an event that could take place, that information would be shared through normal either law enforcement or emergency management efforts. As far as sensitive data, again, the system is based so that you can pick and choose what information is shared and who to send it to. The security model that is in place, as far as the software itself, is it's behind a 3-tiered firewall in New Jersey. As far as the actual software, as far as the information itself, is based on the user profile and user access. Does that answer the question?
It kind of does, and I guess there's a follow-up. Okay, so let's take a little simpler scenario. Toxic industrial chemicals, there's a lot of them in New Jersey, right? Mm-hmm. Are you overlaying information from, let's say, CFATs or voluntarily reported by the chemical producers in the area so that it can be mapped to the hospital capabilities in the area? So I noticed the hospital capabilities, okay, here's our bed, here's who's inside the hot zone, here's who's not. However, the medical countermeasures or their ability to provide for treatment may be dependent upon the particular hazard or threat. Are you taking it to the next level there?
First of all, I should mention that there are policy questions and software questions. A large part of that is a policy question. However, what Hippocrates does have in it right now is a predictive and planning plume model that has taken 25 of the chemical sites in New Jersey, and through initiative with Rutgers Environmental and Occupational DOC, apologize, forget the rest of the acronym, has actually plume modeled 25 of these sites so that hospitals would be able to see what types of plume might come over their facility during an event. So the capabilities there, I will not tell you that it was used a lot, and part of it was based on the fact that we pretty much only gave it to people who asked for it. We didn't make that very public. So the answer is yes and no. Yes, the system does have some of that in there. However, we have been very cautious in allowing users access to it.
Okay, and then one final question, just related to WebEOC, because I'm down in the Virginia area, and part of my team works with FEMA for interoperability in the National Capital Region. The various stakeholders in the National Capital Region use various softwares that are owned by them or maybe by the state. With this system, let's say this is a better mousetrap, for our argument's sake, if New Jersey is willing to share it across jurisdictions. Would WebEOC data be able to be integrated into this? What would be the mechanics of this? Where is it totally different than WebEOC, or is there fungibility for the data to be poured in? Can you address any of those issues?
Obviously the $1 million question, and I think what we're looking at is working with the usage program to develop that middleware between WebEOC, eTeam, et cetera, for a plug-in to a national type of system. Like on its own, you could develop. I'm sorry, I didn't mean to interrupt. Go ahead, please.
No, it's just, is there a time frame as to, is the capability exist, or is it something that you have to continue to build out with funding?
The capability does not exist right now, and again, New Jersey has not moved forward to try to do any of this because we're not a vendor, so we were just developing it for ourselves. However, as the product developed more and more, it became more apparent that there might be advantages to moving it outside of just the health department.
Okay, great. Thank you so much.
Mm-hmm.
Dave, 2 questions from one listener. First, how does one volunteer, and are there any plans to include modules that capture after-action or lessons learned data, executive summary generation notwithstanding, or to use Hippocrates to run exercises?
Let's start with the first one, how to volunteer. I think there should be a slide that'll come up that'll give my contact information, and I would be working with the All Hands Consortium to put together something, a pilot, and there's the slide, thank you. So there's my contact information, and we would all work together to try to come up with a project if there was enough interest in it. So that's part one. Part two, as far as capturing after-action information, lessons learned, there is a gallery in Hippocrates, and an upgrade that is going to be rolled out. I can't remember if it's next week or in 3 months. Will be a more sophisticated gallery that will allow for placing information, lessons learned, etc., in certain areas that make it a lot easier to get to. But as far as an automatic capture of lessons learned and after action, we haven't looked into that. That has not been developed yet. That does lead into the exercise capability. One of the capabilities of Hippocrates is the ability to capture what's on the screen at a particular time, to save that information and then bring it back either as a picture that you can't do anything with, or you can bring it back and bring it back dynamically and pick up where you left off at that point. So from the exercise perspective, that was one of the reasons for development. There is actually an exercise site that we haven't rolled out yet that we are building out to allow for conduct of exercises independent of actual information.
Okay, thank you. Another question. You mentioned that you share data when necessary. How do you manage secure access in an emergency without having to assign usernames and passwords to a wave of mutual responders? Does Hippocrates enable role-based access rights?
Yeah, there's role-based access. If you wanted to get it, if there was an event that took place and a large amount of users all of a sudden logged on, it does become administratively heavy. We have never had that situation, and I think there would be concern that if you had all of a sudden hundreds of people wanting to log on to the system, that what would, speculative, what would probably happen is they would all be lumped into one general category to allow for certain information to go to that category of user, and then as the situation developed, there would be gradual split of those users into separate information exchange groups.
Thank you. Will Hippocrates generate NIMS or ICS compliant reports?
Not right now, no. There is, where we have discussed the actual development of forms that are NIMS and ICS compliant. On the survey modules, you can develop forms that look like that, but right now the answer is no. Those are not. They're not there.
Okay, Dave. That's all the questions that we received. I wanted to thank you on behalf of the All Hazards Consortium for your presentation today and for the time that you spent in putting this together. We really appreciate it.
My pleasure. Thank you.
Sure. And I just wanted to thank all of our attendees for listening to today's webinar. Feel free to follow the consortium's activities at www.ahcusa.org. And I wanted to also remind you that a very quick survey is going to pop up after the webinar concludes, and you can always contact us for more information at info@ahcusa.org. This ends our webinar, and thank you so much for joining us today. Have a great day.